Let's go through the research behind the top 2 natural DHT blockers for hair loss, pumpkin seed oil and saw palmetto, so that you can see if it's actually worth taking and if it actually works for androgenic alopecia. So number 1, pumpkin seed oil. One of the best and most famous clinical trials was done in 2014, and this was done on men with androgenic alopecia. They took pumpkin seed oil 400 milligrams per day for 24 weeks. Now there were 76 men included in this study, and overall at the end of the 24 weeks, they had a 40% increase in total hair count, which means they had 40% more hair on their head versus the placebo group that only had a 10% increase. So this really shows that pumpkin seed oil is very effective for hair growth. And if it was this effective for men, it might even be more effective for women, because it's often harder for men to see such significant regrowth because they have higher levels of DHT and more sensitivity to it. Adverse effects were not noted in the group with pumpkin seed oil compared to the placebo group, so there weren't any side effects either, which makes it a pretty risk-free treatment to go with. Then another study was done on women with androgenic alopecia in 2021, where they compared 5% minoxidil foam to topical pumpkin seed oil. And actually the pumpkin seed oil performed really well. Minoxidil did a better job in making the hairs slightly thicker, but pumpkin seed oil actually did a better job at stimulating regrowth and reducing vellus hairs, which are miniaturized hairs. And the conclusion of the study is that pumpkin seed oil is a promising treatment for hair growth, especially in females with androgenic alopecia. Another study in 2019 found that pumpkin seed oil can reverse the effects of testosterone, proving it to be a good treatment for androgenic alopecia. Now, there have been more studies on pumpkin seed oil as well, but these are some of the most famous ones. Now, while research is more limited than with treatments like minoxidil, finasteride, and prescription treatments, the research that exists is very, very promising. There's also a lot of anecdotal evidence around pumpkin seed oil. Now, let's move on to saw palmetto. So one of the most famous pieces of research around saw palmetto for hair loss was done in 2020, and this is actually a sort of research study that pulls together information from lots of different clinical trials that have been done on saw palmetto, and it has some really interesting data in it. So let's go through some of the different trials that are mentioned within this research study. One of them is a trial that was done on 35 men with androgenic alopecia, where they took a saw palmetto supplement for 6 months. Outcomes were measured via phototrichogram, and actually there was a 23% increase in anagen hairs, which means 23% more hairs were actually in the active hair growth stage. There was an increase in hair density at the 6-month mark in 83% of the patients in the study. This was a study from 2017. In 2016, there was a 24-week study on 50 men with androgenic alopecia, where they actually applied a lotion with saw palmetto to their scalp. And by the end of the study, by the end of the 24 weeks, thick terminal hairs increased by 74%, which is crazy. And their male pattern baldness got better as well. It went from a stage 4 to a stage 3, meaning that their overall thinning reduced. Now, for just a topical lotion, these are some pretty